Welcome back to another episode of Dentistry's Growing with Grace podcast. Join Grace and her guest of the week as they discuss lessons learned in the industry and explore unique insights into ethical growth.
Hello and welcome back to Dentistry's Growing with Grace. I am very excited to have my dear friend, Dr. Moorhead, here with me today. How you doing?
Doing well, Grace. Thanks for having me.
Thank you. Thanks for being here. So you and I, how long, I want to say we've known each other for a few years now.
4 or 5, probably.
4 or 5 years, yeah. I think we met at SCN.
Yes.
And
first morning breakfast, I think.
Yes. And
I saw this bright beaming face.
What'd you say?
I saw this bright beaming face in front of me.
You've always been just so kind, so outgoing to everyone you meet, and you just have a way about you. I'm so excited for those of my friends that don't know you. I'm excited to be the person to introduce you to them. So tell me about StreamDent and tell me about your background. What led you to creating StreamDent?
I had an event. First of all, StreamDent is a set of checklists for running a dental office. Think getting on the plane, and would you get on the plane if you knew that the pilot wasn't going to run the checklist? You wouldn't stay on there. Medicine applied these principles back about 15 years ago, but dentistry's been slow to accept it. So I designed a product that are customizable checklists for running a dental office. But what caused me to get so interested happened 11 years ago. I have been in practice for quite a few years.
You have to tell us how many, because no one's going to believe, because you look so young and your whole family looks so young.
Yeah, I'm 39 years into dentistry. That means I'm 37, by the way. I started 2 years before I was conceived. I started dentistry. Anyway, 11 years ago, I had been doing sedation for like 9 years and IV sedation for 6 years. And I won't make the whole long 10-minute story, but bottom line, I had a patient that I sedated. He was 72 years old. He followed instructions exactly like he was supposed to. Everything checked off just fine. We're taught in older adults that if we're giving sedatives to go slow because they work faster and they work more thoroughly. So I gave him a tiny dose of midazolam, Versed, and we're used to seeing the pulse oximeter beep, 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 beep go down. And I, by reflex, tilted his head back, just like we're taught in basic life support. And I reached for the oxygen, put the oxygen mask on him. At virtually all the time, solves the problem.
And what happened?
The oxygen did not come on. We were radios in the office. I radioed. Somebody did not turn on the tanks. And what seemed like an eternity later, it was like 45 seconds, I think, in reality, they radioed me and said, "Doctor, all of the oxygen tanks are empty." And the emergency tanks were empty. Now, fortunately, I was able to get my wits about me, and I was able to administer a reversal agent, partially reversing, even still be able to keep the appointment. But I had a near calamity, and it was a wake-up call. You see, everything had lined up perfectly. Someone on Friday had checked the inventory on the oxygen tanks and left them on. Someone else the day before, when we were seeing patients, had left the oxygen on in the operatory, so it drained them. Same thing happened to the emergency tanks over weeks, and I had failed to train them on the emergency tanks because I didn't see the likelihood of us ever needing it. Well, all of the pieces of the holes in the Swiss cheese lined up to almost the perfect emergency. That was my wake-up call. That's when I really got interested in systems. But as I've gotten interested in checklists and systems, it's been amazing how I've been able to error-proof the office, make things so much easier. And my team embraces them and my clients embrace them too, because the systems have their back. Instead of having a dentist say, "What did you do wrong?" It's, "Did you follow the system? Yes. Let's look at the system and solve the problem."
I love that. And this has always been on my mind because I own a marketing agency. We support dentists, as you probably know.
Yes.
And people are always asking me, well, who's my person going to be? In dentistry, they think like if you do marketing, you're going to have one person that does all of your marketing. and that's going to be your one person. Well, we don't. We have 12 people, and they're experts in different areas, and there's complex workflows in place. And if one person misses a step or checks something off as done that wasn't done, it could compromise the ability to get results for at the same level that we're used to seeing for every other client.
Yes.
Yeah. So in my mind, I've always thought, well, why don't dental practices run this way? Why don't they have more guidance and step-by-step and accountability and training? And they think they do, because they have an office manager who has maybe great steps and processes, but what happens when she's sick? Or what happens when she's on vacation? Or what happens when, she, for whatever reason, moves on or retires or isn't a part of the practice anymore? It's dangerous.
Yes.
It goes away.
And we're by nature human, and we're flawed. And if we depend on what's up here, most of the time we get along well. And dentists are taught to depend on what's up here in dental school. But in the process, we miss little things, especially for things that we don't do as often. I have seen dentists quicker to embrace the idea of having the team use it, and then gradually they'll start seeing the advantages. And granted, if you've done something 10,000 times, the likelihood that you need a checklist is low. But if you do something out of the ordinary, it's very helpful. And for those special exceptions, it's got your back.
Yep. And I just love it. So talk to me a little bit about, who is this for? Who in the practice? Because I know you gave me a very clinical example, maybe a clinical checklist. Talk to me about how StreamDent might be able to support the different roles in a dental practice.
Okay, well, let's say someone is sitting at the front desk and they get a phone call, and they've got someone calling and they say, my temporary crown's off. Now, the typical scenario is they are going to put the patient on hold, go back to the doctor, ask, and 2 minutes later come back and schedule the patient, right? But what if you had a checklist at your fingertips that showed exactly what to do for all of those funny scenarios? Then instead of the patient being on hold, they've got an immediate answer. And so the productivity at the front looks better, the doctor's not interrupted, and the whole flow of the office improves.
That's awesome. As a business owner that works in the business just like a dentist, interruptions are, it can make a really great career become something that you start to dread, because it's you hit this decision fatigue point where you're just like, oh, not another thing.
I saw a TikTok video last night that said a 20-minute interruption in your day equals, if that's every day, equals a year of your life.
Wow. Yeah. I've also heard a stat. I heard this from my husband. I don't know where he got it, but I heard the stat that every interruption, it takes you 7 minutes to get back to where you were prior to the interruption.
I hope that's not the case for dentists as many times as we've been interrupted. But
I hope that's not the case for dentists either, but I think it could be for me. It definitely could be for me. So can you give me some other examples on how we would apply the use of StreamDent in a clinical setting?
Sure. So let's say that the office has 20 new patients a month. Our medical histories are getting long, and I've heard dentists say occasionally it takes 5-7 minutes just to review a health history. So the dental assistant brings in the patient, they take the list of the medicines, they've got the yes or no questions, they take the blood pressure. Dentist comes in and has to weed through all that stuff, right? So what if we could give the dental assistant or the hygienist instantly all of the information that's in the dentist's head up here? so I created a list of things that we automatically, as a dentist, know that we're going to ask if the patient's got a condition. For instance, asthma, we're going to ask how severe are the attacks, what treatment medicines do you take, what do you, et cetera. If the patient's got high blood pressure, they're going to ask blood pressure medications, they're going to ask if they've got associated diseases, whatever the problem, diabetes, whatever, they've got at their fingertips the questions that the doctor would ask. I have been told that where this normally takes 1 to 2 minutes, that if you've got 30 new patients a month, that's automatically going to save the doctor an hour of billable time that they could be someplace else.
I'm going to be challenging here because I like to do that sometimes.
Okay.
Do you think that there might be some advantage in the doctor asking specific questions to the patient around?
It's a fair question.
Thank you. Because as a patient,
sometimes I
wanna
have
know.
to go back. Some of the questions are going to be more delicate. For instance, I do IV sedation, I mentioned. And my dental assistant, when they're going through the sedation consent, they ask a female, are you pregnant? I ask, when did you have your last period? I've got to know before I give them medications that could mess up a pregnancy that there's zero chance that they're pregnant. Now, if I would have asked that question 39 years ago, how dare a dentist ask something like that? Fortunately, now people see dentists as doctors of the mouth. So it's changed a lot. But yeah, there's an occasional question. There's also things that patients omit. They didn't even think about putting it on their health history. I'll see a large neck and I'll wonder if they're bruxing, and I ask 2 questions to screen for bruxing. I ask if they're a restless sleeper. 95% of restless sleepers grind their teeth. But I see the big neck on the guy, and he said, no, I'm not a restless sleeper. And then I said, do you snore loud? Yes. Has your wife ever said that she's heard you stop breathing? Yes. Cha-ching. 99% of sleep apnea patients grind their teeth when they sleep.
Wow.
And if patients don't know, they're not going to reveal it. And if they don't think about it, they're not going to reveal it. So yes, the dentist still has to get in there, but still you can save a tremendous amount of time by giving the assistant or the hygienist those tools to be able to use.
I think it's great. So the assistant or hygienist or whoever on the team really can screen and ask the important questions and give the important information to the doctor, minimizing the accidental oversight of important information. And then the doctor can pick and choose exactly what's asked to the patient. I think a lot about I just termed this today dental psychology. It's not a thing. But I think a lot about how patients are perceiving the doctor, and when a doctor slows down and asks me a question about my health, even if they already have the answer, it shows that they're caring, that they heard it, that it's intentional. But if you do this first, you have the information. You're not just asking to have the information. You may be asking on something specific so that the patient feels heard.
Mm-hmm.
So
I develop my rapport not by asking medical questions, but by interacting with the patients, by just being upfront, eye to eye, before I lean them back and let them know, now, for your exam today, my job is to diagnose and make recommendations. I don't pretend that my job is to make decisions for you. I promise I'm not going to push you in anything. I just want to help you to be able to be informed so you know what's best for yourself.
that would go a long way with a patient that's having a hard time with trust. That would go a very long way. Just letting them know it's my job to tell you what's here, to tell you where you're at. So the way that I'm hearing, I think this is so crucial. I think this is a crucial problem in the practice. I think not having clear step-by-step instructions for almost any situation is where over 90% of stress, maybe 60% of stress. I'll say 40% is having the wrong people in the wrong places, but this solves a lot of that.
I used to have to stop 3 or 4 times during a procedure for the dental assistant to run the sterilization to get something. And even for someone that's experienced, if they have a checklist to be able to look over to see the things that they need to bring into the room. So the experienced assistant sets up for the procedure and then just takes 15 seconds to bring up the list and make sure that they've got everything. For someone that's not experienced, they've got access to downloadable copies of the tray setups, of the burr blocks. They can know exactly what to say for going over consent forms and the least number of words. Now, they still use the practice management system to sign it, don't get me wrong, but I think you already know how long those consent forms can be. And if you read the whole thing, you put them to sleep and they're not paying any attention anyway.
Mm-hmm. It's a missing piece in the practice. This guidance is a missing piece in the practice. Okay, here's a great question. There's someone somewhere going, yeah, this sounds great, but what would the setup time look like? How in the world am I going to be able to create this in my practice? It's just one more thing. How do I find the time?
Fair question. When consultants look at my product, if I'm doing a live demo with them, and I show them how many checklists I've got pre-built, because it's hundreds and hundreds, the typical reaction I get is, how did you find time to do this? I started it back in the recession, back in 09 and 10. I told you after the event with the IV sedation guy that stopped breathing. But with the pre-built checklists, you still have to customize them to get the use out of them. There's a concept called a relational database for nerdy people like me. The short story is, if you change something in the software, in my software, and it recognizes, let's say I've got in there that you want to set up a anesthetic syringe with a red 25 gauge needle. We just say red needle because if it's too long, people don't take time to read it. So red needle and lidocaine. And the doctor doesn't use the red needle, they use the yellow needle. They make the change in the software and they say change, and the software instantly finds 30 other places that exact reference is. If you answer yes, you've already customized 30 other pages, 29 other pages.
It gives you the option though.
Yes, and so as you customize it, it keeps building on itself and saves you more and more time. And I've got guides on where to start, on how to get the most use, because there's a few procedures that are 90% of dentistry. In most offices, it's fillings, extractions. I'm talking about on the dentist side now. Fillings, extractions, root canals. That's 90% of what we do. So get those things customized and you're up and running most of the way.
Mm-hmm.
I had a dentist in San Francisco that was referred to me by a consultant. I get a lot of referrals from consultants. And after 3 months of using StreamDent, the consultant said, I want to tell you about Dr. So-and-so. They're going to hire, they've lost their front office person, and they're going to hire someone that has no dental experience. She said they wanted to find the best person for the job because they had the security that StreamDent would be able to teach them the dentistry, so they could find the best fit for the job instead of someone that knew dentistry. That felt really nice.
I think that's such a huge advantage. And right now we're in a time where teams are they've been uprooted by COVID, and there's a lot of shuffling of employment and where people want to work and what they want to do. And I think one of the biggest pain points right now is finding people that have integrity, that have a strong work ethic, that are trustworthy. And it's very limiting if you can only pick from people with a great deal of dental experience.
Yes.
So this really opens up the hiring pool. So if someone's interested in learning more, what's the first step that they would take to find out if StreamDent is a fit for them?
First of all, give me a call. Let's get contact information up here. Give me just a second. There we are. Here is my contact information.
Okay.
Email is dr.m as in Dr. Moorhead, at StreamDent.com.
And
Phone
for those
number-
listening, you can go to StreamDent.com and get contact information and find out more information.
And some videos that show you the product. Sure.
Awesome.
The phone number is 502-509-1570. That's a Google Voice number that rings into my office and to my cell phone. So they can reach me about any time. One other neat thing about the product, we have all kinds of videos that tell how to. So you don't have to reinvent the wheel, and it goes about telling you how to make the systems work for you.
It's awesome.
So 502-509-1570 or dr.m@streamdent.com.
Wonderful. Well, thank you so much, Dr. Moorhead. And thank you to our audience. Thank you for being a part of our Facebook group, Dentistry is Growing with Grace, as well as our podcast. If you have a topic that you'd like to share with the dental community or information that you think will help all of us grow, please reach out to me. You can reach me at grace@identitydental.com, and let's talk about having you on the show. And definitely join our Facebook group. We're always looking to share helpful information. Thank you all so much and have a wonderful day.
Thanks, Grace.
Thank you.